Together we achieve victory over heart failure.
Hello and welcome to our podcast. I'm Dr. Sasirekha, the consultant cardiologist at Manipal Hospital, Mysore. And today we are delving into a silent epidemic that India is combating, heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence to witness young adults seeking medical assistance for heart failure, unlike in the Western countries, where heart failure is predominantly a disease of the elderly. Let's break down the 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have heart failure? When people get a diagnosis of heart failure, they think it's the end of their lives. The term heart failure can seem frightening, but it simply means that your heart is struggling to pump blood as efficiently as it should. The ejection fraction, or EF, measures how well your heart pumps blood. It is the amount of blood pumped out of your heart's lower chambers, that is otherwise called the ventricles, each time it contracts. While the normal EF is around 50 to 70%, individuals with heart failure typically have EF of 30% or lower. Now, second point, why are so many Indians affected by heart failure? Genetics plays a significant role. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, hypertension, diabetes, obesity, and smoking worsens this epidemic. Moving on, what are the signs and symptoms of heart failure? Watch out for confusion, fatigue, heart palpitation, nausea, shortness of breath, and weakness. There's also loss of appetite or vomiting. Now, how can we protect ourselves from this deadly disease? Hearts work incredibly hard to keep us alive. These are 5 golden rules we can follow to return the favor. Early detection of heart failure through regular blood tests, dietary adjustments to maintain heart health, incorporating daily exercise into your routine, practicing stress management techniques, quitting alcohol, tobacco, and smoking. Lastly, what comes next after a heart failure diagnosis? Thankfully, medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medications improve quality of life and longevity. Devices like biventricular pacemaker, implantable cardioverter defibrillator, and heart valve repair or replacement are a few of the options that we have. And as a last resort option is heart transplant. The lifetime risk for congestive heart failure is 1 in 5 for both men and women. Remember, awareness and proactive measures are key in combating this silent epidemic. Thank you.